Well, thank you, and just thank you so much for coming. It's always nice to have a lot of people in the room, and I look at it as well as an opportunity to share information that no other time of the year do I get to share some of these things. Some of you might read pieces, or I might talk to you, informally, but now is a time where you get to hear information, some important details of things that we are doing. So tonight we're also going to celebrate some amazing successes, raise funds for our work to stop the government takeover of healthcare, and give you reasons to oppose Medicare for all, or the stealth version of it called public option. We're also celebrating you. I'm just really glad you have come. We cannot do what we do without you. Thank you for using your valuable time to come here, to learn, and to be part of this evening. Now, if I don't know you yet, so I was walking around the room, but there's only so much time to try to meet you all in person. But if I don't know you yet, and this is your first introduction to Citizens Council for Health Freedom, I give you a special welcome. And I also offer an invitation. If anybody wants to come and have a conversation with me, feel free to either call our office or leave your business card or a note with any of our staff, and in short order you will meet our staff. So I also want to thank our event sponsors, our board of directors, our event coordinator, Mary Amlaw, wherever she is, and our enthusiastic volunteers and staff. This evening would not have been possible without them or without you. Now, when Martin Kellogg, so I'm actually the co-founder, Mike. I'm the co-founder of this organization. When Martin Kellogg, a Minnesota business owner, and I started this organization, started this work 25 years ago, I never imagined this day. I could never have imagined 25 years. Our first organizational meeting was November 30th, 1994, and I left my job as a registered nurse in March of 1995 and wondered how to deal with that thing called the legislature. And I thought I'd better just go over there and figure it out. Unfortunately, Martin is not with us tonight. He passed in March, and we miss him dearly. But I'm pleased to say that his wife, Esther, his daughter, Janine, and his son, Bill, are here. Where are you? There you go. Also here tonight is former Minnesota Senator Jen Olson. She was the first person I met with in 1994, and her information led me to Martin. So please give her a round of applause. CCHF is the only organization in the nation whose sole purpose is stopping a government takeover of the healthcare system. Single-payer systems, where government is the sole payer of medical bills and doctors and hospitals are socialized and under government control, can be devastating. Let me tell you a story. A doctor recently told me about a woman he knows who was biking in France this past July. She got an abdominal condition that required surgery, but the hospital had run out of money for the rest of this year. So the surgeon wasn't allowed to reserve an operating room. Her only available treatment was antibiotics, unless her condition progressed to peritonitis, a dangerous inflammation of the gut. So she chose to be medevaced back to America, where she was immediately taken into surgery. So it might interest you to know that France was ranked as the #1 healthcare system in the world in 2000. The World Health Organization gave America a lowly number 37 because we don't have a centralized system. But deep in their report, we found a statistic they didn't bother to announce to anyone else in the world. America was ranked #1 in patient-centeredness, a characteristic found only in a free society with free markets. And our organization aims to keep it that way and to restore the freedoms that we've lost. So running in parallel with our efforts against socialized medicine, we're working to rescue the charitable mission of medicine from the cold-hearted business of healthcare. Many third parties, from health plans to government to their 1.5 million business associates, have claimed a right to intrude, a right to tell doctors how to practice, a right to monetize your private medical information, a right to impose penalties in and outside of the exam room, and a right to tell patients what they can and cannot do, or deny them access to care if they refuse to comply. This makes care and coverage not only unaffordable, but intrusive, uncharitable, and unfriendly. It's as though patients must serve the system, not the other way around. All of this has made a nationalized single-payer healthcare system look pretty good to some people. That said, the good news is that Americans don't like limits. A 2019 survey found support for Medicare for All plummets from 71% down to 26% if it would delay access to care. And you know it would. It would also eliminate your choice of coverage, ending all private insurance and all of today's public programs, including Medicare. This may be why several Democratic presidential candidates are pushing for the public option instead. It sounds like a choice, but that would only be temporary. A public option program is considered a path to single payer. Thus, I call it stealth Medicare for All. Citizens Council for Health Freedom is unique. We focus solely on the issue called healthcare. We work from a patient-centered and privacy-focused perspective, and we're pretty uncompromising in our views. Thus, it was quite surprising that HHS Deputy Secretary Eric Hargan, otherwise known as DepSec, the second in charge of the U.S. Department of Health and Human Services, selected me to be just one of 18 people to participate in his Quality Summit. I'd met him for the first time a month before I was selected, and I essentially told him that healthcare quality can't be quantified. It can't be measured. Experts don't even agree on the definition of the term. His summit meetings in DC, however, focus on the congressional mandate that doctors submit boatloads of patient data to the federal government to measure the quality of care. They call it quality measurement. We call it compliance enforcement. It has put doctors under the thumb of government and has instead diminished quality of care. The first summit meeting was last Friday. There's another in October and a third and final one in November. Logically speaking, I should not have been there. More than 300 people applied for the positions, and the other 17 individuals participating are industry executives, physician executives, hospital executives, former government officials, quality measurement organizations, and researchers. They're all in the quality measurement business. I am the lone voice for freedom, for patients, and against quality measurement. But apparently, DepSec wanted me in the room. As a result, I brought patient stories and statistics no one else shared, including the story of a nurse who told me that 85 to 90% of her time every day was spent with the computer, not with patients. 85 to 90%. I brought up the fact that it costs $40,000 per doctor, or $15.4 billion a year to do this reporting. And that's just the cost for the reporting part. I said quality measurement has reduced the quality of care and endangered the patient's safety by distracting doctors and nurses from their patients. I also said patients may define quality quite differently than the government and their contractors define it. And I opposed their plan to use quality measurement for cost containment, saying it would lead to less access to care. As the head of CCHF, I brought a perspective unmistakably different than anyone else, a perspective against what they were all there for. Surprisingly, several people said they liked my comments. Well, I'm pleased to say that Deputy Secretary Hargan was in the room almost every minute of the entire day and listening to my comments and the discussion. So is the attorney who will use our comments to make a plan for the president. And Don Rucker, the National Coordinator for Health Information Technology, the man responsible for ensuring that the government-certified electronic health record can collect and report quality measurement data. He was there too. all day long. I was in that room last Friday speaking truth to power, kindly, gently, firmly, and hopefully persuasively, solely because of freedom-loving Americans who generously support our work. The government doesn't cover any of the costs to get me there. But aren't you glad I accepted the invitation? So let me share a few more highlights of our work, many of which can be found in your program. So I just want to make sure that y'all got a program and you didn't sit on it. We put it on chairs and I went around and some people were sitting on it. So just so you know, it's there. First, I'm pleased to say that the Wedge of Health Freedoms map of direct pay, cash, check, or charge practices only continues to grow. Find it at jointhewedge.com. We have practices all over the country. I hope you met one of these physicians who was here tonight with a display table. Now, where are those physicians? Where are the Wedge physicians? Are you here? Oh yeah, they're all over there. Good. So thank you for taking another route, which is to cut yourself off from insurance companies and government and go directly to the patient. Thank you for that. Second, we've been pushing the Trump administration to undo an executive action of the Clinton administration, which would let seniors opt out of Medicare without losing their Social Security benefits, as is their legal right to do. We've built a coalition of 44 organizations nationwide who co-signed our letter to President Trump. Every meeting we have in DC brings us closer, brings us higher up the White House chain of command. We found being face-to-face is very helpful, and we are working hard to get this freedom for seniors before 2020. That's our request, and it's looking hopeful, but there are no guarantees. So say a prayer and stay tuned. Third, staffers in Congress now call us and ask for our advice. This is the value of going to DC and building relationships and being an informative resource. They ask for ideas, amendment, and bill language. We're also asking them to protect your freedom. We're working to stop the national database of patient information that's in a Republican bill. We're working with a senator to craft language that will restore parent consent requirements for research on the newborn DNA that is stored by states without parent consent after newborn screening. We're opposing the bipartisan surprise billing legislation because it imposes price controls on doctors nationwide. We're also working with Senator Rand Paul to try to stop the national patient ID and tracking number that is in a bill the House has already passed. Now, the good news for today, I put it here in italics because I thought, I don't know if it's public, but we got the good news that Senator Rand Paul's amendment to forbid the development and funding of a national patient ID has been put in the appropriations bill. So yay to him. So some people ask why we're so focused on privacy. We have a saying, he who holds the data makes the rules. A national health data system empowers a national healthcare system. It allows government to control doctors. In short, privacy rights are the foundation of freedom. My book, Big Brother in the Exam Room, makes this connection very clear, and it's being sold after you're done here. Finally, we're working to end the Obamacare prohibition against catastrophic coverage, which has shut down affordable indemnity medical insurance. We envision a future where restrictive prepaid health plans are not our only option, where real insurance, the indemnity kind, sends checks to patients who use them to pay their own bills and never interferes in treatment decisions, never limits what drugs are available, never says which specialist you can and cannot have. Inside tonight's program, you'll also find some major wins for freedom at the Minnesota Legislature. You'll hear more about this in just a moment, as well as our unique initiatives. Know this, each of you here tonight is very, very important to the work that we do. Most of our financial support arrives in the last 4 months of the year, starting with sponsorships for this event. So thank you very much, sponsors. And this means that we're raising money tonight to pay for the rest of 2019 and the start of 2020. Our goal is to raise at least $75,000 tonight. So thank you for coming and for considering how you might help us reach that goal. Under the pie chart inside the program, you can see the list of items your gifts will support. But what you won't find on that list is our biggest expense, which is also our biggest asset. That's our in-house team of hardworking, highly skilled, dedicated individuals. These all-stars are unmatched in their enthusiasm for what we do here at CCHF, and I'm grateful for each one of them. So I'd like you to get to know them. Come on up. First is Matt Flanders, our state legislative and policy director. He's a soccer player, comes into the office with a broken toe here and a bruised rib there, and fixes cars with the best of them. He's been with us 4.5 years and spends much of his time at the Minnesota State Capitol during the legislative session. It's because of Matt that Minnesotans still have the strongest privacy law in the nation. And it's because of Matt that we get as many appointments in DC as we do. He's become quite adept at getting them. Matt.
Well, good evening, and thank you for joining us tonight. As Twila said, I've been here for almost 5 years now, and I have to say it's been a very cool experience to be able to learn from the best and also to work with the best. So thank you guys too. I primarily focus on our legislative affairs, so if anyone has any questions about anything we work on or any comments about any health policy issues in general, I would love to connect with you after the event. Please come see me out in the foyer.
Thank you, Matt. Okay, next up is our newest team member, Richard Larkin McClay. Richard began just 10 weeks ago as our communications manager. We've discovered that he likes donuts, whistles while he works, and has a strong work ethic. Starting this month, Richard took over our entire press relations operation. He's pitching the news media, writing and issuing press releases, creating a comprehensive communications plan, engaging reporters to consider our perspective for their stories, and editing everything that comes out of the office. Richard?
Wow, with all of that, I'm surprised I made it here. Like Twila said, I'm Richard. I'm CCHF's communications manager. So if you see a typo in anything, don't tell me. No, I'm new to this fight, but I'm excited to embark on this journey to securing our health freedom with you all. Thanks.
Thank you, Richard. Finally, meet our office manager extraordinaire, Karen Markowitz, whose love of dogs, appreciation of the Iowa Hawkeyes, and enthusiasm for Star Wars exceeds all bounds. Many of you have interacted with her over the phone, and many more of you will. It's because of Karen that our office runs so smoothly. Karen goes above and beyond the call of duty to have everything done and have it done on time. Karen.
Hello, everyone. I have been here for almost 1.5 years, and it's been an amazing journey, an amazing experience, and an eye-opening experience, learning from the very best, Ms. Twila Brase. So thank you, everyone, for coming tonight. It's been really fun, too, to be able to connect some faces with names over the last year. And as Twila said, it is football season, so go Hawks.
All right, a round of applause for all of them. So every one of them and me wants our team to be bigger. You might say we use every minute of the working day and more to get the job done. To that end, we're planning for a new administrative team member in 2020. This will provide all of us with needed administrative support and free me up to spend more time on outreach, writing, and strategic planning. Speaking of the team, I've asked Matt to give you a short summary of our legislative successes. Matt, the stage is yours.
Can everyone hear me this time around? I think I didn't quite pull the mic up far enough the first time. So good evening once again. I, like many of you, am very excited to hear from Mr. Baker, hear his experiences as he's helped Canadians escape from the consequences of socialized medicine. At CCHF, we have worked at great length over the past year to stop socialized medicine and to remove third-party intrusion in healthcare that should be between the patient and the doctor. In Minnesota, we had a particularly successful legislative session advancing patient privacy and free market medicine principles in this state. We worked with Republicans and Democrats in both the House and the Senate and successfully stopped bills that would have repealed patient privacy and consent rights. Minnesota has the strongest patient privacy law in the nation, and each year for the last 4 or 5 years, the industry and the bureaucracy has tried to remove these consent rights because apparently it's either too inconvenient to ask a patient where they want their health information or to honor the patient's wishes. The reality is, few would consent to the information sharing if they knew where it was actually going and what it could be used for. To counter the bills that end patient privacy, last fall we worked with the bipartisan Minnesota Legislative Commission on Data Practices to create a universal consent form for Minnesotans, a document that would allow patients to control their own information by sharing as much or as little as they decide. This consent form secured the recommendation of the commission, and we were able to get bills to implement the form introduced by Representative Peggy Scott and Senator Warren Limmer. The Senate bill was co-authored by 2 Democrats and 2 Republican committee chairs, while the House bill was co-authored by 12 Republicans and by 4 Democrats, including 3 committee chairs. Although this bill did not pass, it sent a strong bipartisan message that there are members in the House and the Senate willing to fight to preserve patient privacy in Minnesota. These bills were no doubt an influencing factor in our successful defense of Minnesota's strongest in the nation privacy law. Now, anyone who has followed CCHF or heard Twila speak or read her new book, Big Brother in the Exam Room, knows that we have long opposed the government-mandated electronic health record. The government-mandated EHR was designed for billing and data collection, not patient care or patient record keeping. Minnesota had a law requiring EHRs for all providers, from which we secured an exemption for solo and cash-based providers back in 2015. This year, we were able to work with Senator Scott Jensen, a practicing physician, to finally repeal this harmful and costly state mandate. The bill was included in a larger bill, which was signed into law by the governor in June. Now, Minnesota doctors, dentists, psychologists, clinics, practices, and more have the freedom to use a medical record system they deem is best suited to their practice and their patients' needs. Another major accomplishment involved the Minnesota Prescription Monitoring Program, or PMP. The PMP is a government surveillance database that collects patient and doctor prescription data without consent. After learning of ongoing inappropriate access to the database, we worked with key Republicans and Democrats to secure language requiring an annual audit, as well as appropriate and timely termination of user access. Most importantly, the language, the first of its kind in the nation, will allow Minnesota patients to see who is accessing their information. This bill was also passed into law. We also worked with Senate Republicans to successfully remove language from a bill that would have enshrined portions of Obamacare into Minnesota state law. It's probably a bit of an understatement to say this legislative session was crazy, so we are very happy to report these victories. We couldn't do it without your support, both the generosity of your time and your resources. I'd like to especially thank those who, at our request, contacted legislators, submitted testimony, and showed up at important hearings. We have a great team of CCHF staff and an even greater team of CCHF supporters. Before I pass the mic back to Twila, I want to share just a couple of things about our work at the federal level and a few of the many comments that we have received recently. During our last major policy trip to Washington, D.C., we had 3 meetings with the administration, 19 meetings on the Hill, and 3 unplanned encounters with Senator Ted Cruz, Representative Jim Hagedorn, and Representative Dean Phillips. Anyone who has ever had the blessing to try to schedule DC meetings knows this is no small feat. It was both encouraging and exciting to not only get this number of meetings, but to hear the responses by the administration, elected officials, and staffers that we met with. Usually, a meeting on the Hill is scheduled for 15 minutes, but our average meeting time was over 40. Offices in both the House and the Senate liked our ideas so much that they asked us to draft up bill language for them. We received responses like, "We need you here briefing all the members about this," and "It's pretty refreshing having you guys come in to talk healthcare," and "That's the best solution I've heard yet on surprise billing." Or after numerous emails and phone calls with one particular office, a staffer remarked to Twila, "You're my expert, that's why I called you." Shortly after, the staffer also thanked us, saying, "I can't tell you how much I appreciate you folks and your help for the past many months." Now, if anyone would like to know more about this past DC trip or see pictures, please check out the HFW, which will be handed out at the door as you guys are walking out. We may be a small staff, but we have a great impact. Right now, we have the opportunity and the relationships at the state level, as well as with the administration and members of Congress, to continue to make great strides in free market medicine, affordable health coverage, and restoring the patient-doctor relationship. So thank you for being a part of that mission and for being here tonight.
Thank you, Matt. Now, so you can see CCHF through the eyes of others, I've asked 4 individuals to share briefly why they appreciate our organization. So would you all, wherever you happen to be assembled, come over here by the steps, or maybe might be closer. But while they're coming, I'm going to start with Renee Doyle. Now, Renee Doyle could not be here today, so she sent the following comment for me to read. Renee Doyle is currently the headmaster of Genesis Classical Academy way down in southern Minnesota, but she used to be Congresswoman Michelle Bachmann's legislative director. So, yep, you can just stay right there, that's fine. Okay, so here's what Renee writes. I want you to know how much CCHF meant to me while I was working in DC as Congresswoman Bachmann's legislative director. I want you to know if it were not for medical issues, I would be there in person. When I went to work in DC covering healthcare, I quickly found out that everyone has an opinion, but few have information or facts. And no one had a good alternative to Obamacare or even arguments against it. No one but CCHF. In fact, and you'll be amazed at this, in fact, in DC, there was an intentional effort to not come up with a solution or alternative, so Obamacare would remain a hot issue for political purposes. This made my job impossible. Had it not been for CCHF's visits and briefings, there would have been a complete vacuum of intelligent analysis of the biggest takeover of our lives on record. As bills came to the floor, I would pick up the phone, call CCHF, and quickly get facts and talking points for the Congresswoman and other offices. Twila made the root issues clear, and she always had a solution or language for an amendment. Nothing has changed. If CCHF weren't doing what it is doing, who would? Really, who would? CCHF is a big deal. It needs to be well funded. What if CCHF could afford to add another staff member? Now here she is, definitely talking my language. Okay. This is a complicated field of work. It's not for everyone, but aren't we glad that we don't have to do what CCHF does or go where they go? I encourage you to donate generously and make this a year that you and CCHF will not forget. You are our hope. Thank you so much. And thank you to Renee Doyle down in southern Minnesota. So next up is Lee Carisco, a Canadian physician who moved here 17 years ago. And I've asked each of these 3 individuals to speak for no more than a minute. So Lee.
Thank you. I strongly support CCHF's vision for personal freedom in all aspects of healthcare. I've worked as a physician for over 30 years. 13 of those years were in the Canadian system, where people are beholden to the government for the crumbs of health care that they receive. As medical director of diagnostic imaging in Thunder Bay, Canada, one of my duties was to triage the MRI waiting list, which was up to 13 months long. I was the one who would decide how long people would have to wait for their scans. From time to time, I would read a CAT scan or an MRI scan on someone, and they would have a huge tumor or rampant infection, and I had personally sent them to the end of the waiting list. I could not sleep at night working in such a system. A healthcare system that actively impedes your right to seek out the care that you need in a timely way with quality care will also have no compunction about violating your right to privacy. And therefore, I support Twila and CCHF for their opposition to big government and their advocacy for healthcare freedom and privacy. Thank you.
Thank you, Lee. Next up is Dr. Stephen Bergeson, one of the practices on our Wedge of Health Freedom. Steve.
Thank you very much. I want to thank CCHF and Matt and Twila, who assisted me and several direct primary care physicians and colleagues to actually make connections with legislators who are in the process of writing and supporting bills supporting our type of practice. Twila and Matt's knowledge and support put us in direct contact with those who were instrumental in supporting our healthcare freedom. Keeping us involved in the process and helping to write new bills supported by CCHF is moving us in the direction towards greater healthcare freedom. And I want to thank you very much.
Thank you, Steve. And finally, let me introduce you to Susan O'Neill, a woman who's just started volunteering for us. Susan.
I'm Susan, and I'm a new supporter to Twila in the Citizens Council for Health Freedom Group. Healthcare has always been very confusing to me. As a small business owner with variable income, I was always looking for answers to what are the best healthcare options for me. I've been paying high monthly rates with big deductibles, and I have a folder of calls to the state with questions about my plan. And in short, the more I learned, the less I knew. My daughter Kate over here, she's a float ICU nurse, and she met Twila, and she suggested that I meet with her. I've been a nonprofit management consultant for 30 years, and I was able to volunteer in their office. And every day that I went there, I learned something new about policy that I didn't know before. And it didn't take long for me to realize how little I knew and why it mattered. So there's a lot of work that needs to be done to continue to help spread the word, and I'm really happy to be here. Yeah, thanks.
So before I give my concluding remarks, I'd like to share two new initiatives and two exciting announcements. So on the top of your table is a little card, and it's called Patient Toolbox. So we launched the Patient Toolbox website tonight, and I don't have my own to show you what it looks like, but it's just little. It says Patient Toolbox. Our Patient Toolbox will provide online advice 24/7 to patients on how to deal with difficult, often coercive situations. The website, patienttoolbox.org, will include examples of forms, questionnaires, and demands patients are likely to face at the clinic, in the hospital, and when they're having a baby. We include suggested action steps. We'll announce this website in October to the national media and on our radio program. The Patient Toolbox will expand to include other situations and more action steps in the future. Indeed, some of you might call us with some of those that you think should be on there. So also noted in the program, we'd like to build an app for the Patient Toolbox. Second, we plan to build a national library of model state legislation for state legislators and think tanks. We know that most of the patient-centered, privacy-focused laws that we've helped to pass in Minnesota do not exist in other states. We know we can change this by providing ready-to-go legislation. Now for two announcements. Last week, we received an invitation from the White House to attend a briefing this coming Monday on Trump's agenda for the rest of 2019. It's invitation only, and both Matt and I will attend. Second, 2 days later, on Wednesday, September 25th, I'll be presenting at the Cato Institute in DC for a Cato event focused on my book, Big Brother in the Exam Room, The Dangerous Truth About Electronic Health Records. Now, if you're looking for an excuse to go to Washington, DC, I'd love to have you there. Otherwise, it's being live streamed, so you can tune in or watch it later. And if you'd like a copy of my book, we're selling them tonight for just $20 as you leave. Finally, I'd like to draw your attention to the Planning for the Future inside the program on the right side bottom. Planning for the Future section, where you'll find everything from sufficient staffing to owning our own property to building a litigation arm. Perhaps you can be part of making these goals happen. Now, as Americans, we must not, we dare not answer the siren call to single-payer, socialized medicine, government-run healthcare. This means we must not accept Medicare for all or its stealth version, the public option. In a moment, Rick Baker will bring this into very sharp focus. The interesting thing about the issue called healthcare is that it doesn't have to be complicated. Before government policies favored today's prepaid health plans like Medica and Humana, United Healthcare, indemnity medical insurance companies used to send patients a check that the patients used to pay their own medical bills. One man up in northern Minnesota told me in the early 1970s that he had to have heart surgery. And his insurance company sent him a check for $68,000. Which he used to pay his doctors in his hospital. And he said to me, it was simple. And indeed, that's what indemnity insurance is. And not only is it simple, but there's no outside interference, there's a full range of choices, you can go anywhere, see anyone. Premiums were affordable. That's the way it should be in America, and it can be again. This is not rocket science. It's simple, free market economics. It's the power of competitive pricing. It's the power of the dollar in your own hand. It's about leaving pricey third-party payment behind and returning to affordable first-party payment. And that's exactly where our organization wants to go. The time is short, the mission is worthy, and we at CCHF are up to the task. So thank you. So thank you for being here tonight. It's been my joy to share our plans and to show you just a slice of what we do because of you and people just like you all over the country and on our team and in our corner. The future is bright because we're Americans. Yes, because we live in America. And because there's no way that we are ever going to accept a single-payer socialized healthcare system and the takeover of our doctors and hospitals. We're never going to do it. Thank you very much.